Hello, I'm Dr. Stu Silverstein from MedHuman Medical Publications and the author of Laughing Your Way to Passing the Pediatric Boards. And today we're going to discuss dystonic reactions and how this can be confusing on the boards. Oftentimes it'll be described, you'll be presented with a child you think is having a seizure or has meningitis or some other CNS problem, when in fact it's actually a dystonic reaction. Very tricky, very easy to get it wrong, but also very easy to get it right. So let's take a look at a typical way you might be presented with a question like that. You might be given a 2-year-old who has a fixed upward gaze, and that's your tip right there. The fixed upward gaze is that look that you get from your child, at least I get from my son, who's 13, and when I ask him, how do I get on to Snapchat? And he gives me that look where he rolls his eyes up and looks up in the air. That's a dystonic reaction, or in his case, a dysphoric reaction. And throughout the exam, this child that they're presenting to you, the 2-year-old, who has a fixed upward gaze, remains alert and appropriately frightened. That tells you he's not having a seizure. That's one hint. His parents and the paramedics, sometimes the same people, the parents are paramedics, who brought him, confirmed that he has remained alert. His airway is patent, his vital signs are stable, so he's a stable child, just looking up and rolling his eyes, so to speak, and it's fixed. A toxic ingestion is a possibility, and you are asked to pick a pharmacological agent to help to treat him with until you can figure out exactly what's going on here. Now, you can be provided with several choices here. So this question is kind of easier because you might be told that it is a toxic ingestion. Which one is it? You could be given choices like rectal diazepam, which will lead you to believe it's a seizure, but that's the wrong answer. They might tell you to place an NG tube with activated charcoal, also not right, because that's not going to reverse the effects of whatever he's ingested. Syrup of ipecac is always wrong on the exam. Now, remember, they will frequently tell you there's no seizure in one way or the other, either by the physical examination, negative EEG, no past history of seizures, etc., and the fact the child is alert. Now, they actually want you to identify the specific toxic ingestion, and it's easy to grab that brass ring. Again, if they tell you it's an upward gaze, it's a dystonic reaction, which is probably due to ingestion of promethazine or a related drug. Therefore, treatment with diphenhydramine, also known as Benadryl, would be most appropriate. They'll never say Benadryl on the exam, by the way. They never use trade names. So keep that in mind for all drugs that you're studying on this exam. So again, the slippery slope is they will clearly tell you that it's not a seizure, either negative EEG, no history, or suggestion of a seizure disorder, or no CNS infection. They'll tell you the child's afebrile, no suggestion of infection, etc. So where's the money in this kind of question? The money is the history of exposure to or information that the child is taking a medication that can cause a dystonic reaction. Again, look for the upward gaze. That's fixed. Reglan, watch your history of rate reflux. That would be one medication that can cause this kind of reaction. Dextromethorphan, promethazine, risperidine. So remember that if they give you a hint that such as a family member is taking medications for a psychiatric illness, that's also an indication that this is a dystonic reaction and Benadryl is your answer. Hope this has been helpful. Remember to like us on Facebook, subscribe to our YouTube channel, and follow us on Twitter. Thank you.